It's now the winter season when most people wake up with their eyes looking like this or like that, with the complaint of swelling, redness, discharge, sometimes with the pain and difficulty opening it in the morning. That is called pink eye, or in medical terms we call it conjunctivitis. If this ever happened to you or your child, then this video is for you. I'm going to take you step by step on how you can simply treat it right now at home. Let's get started. Sorry to say that most people don't actually understand what is this pink eye or what causes it. And as a result of that, they ended up treating it wrongly or even spread it to someone along the way. Let me help you out now. So what actually is this pink eye? Normally there is a thin transparent layer that covers the white part of your eye and also the inner part of your eyelid called conjunctiva. If this layer gets inflamed, maybe caused by virus, by bacteria or allergy, your eyes start to become reddish with swelling, with discharge, sometimes with even itching. That is what is called pink eye. But the mistake that most people do is they think that all cases of pink eye are the same, so therefore their treatment should be the same. This is not true. Now, let me ask you this question. If you look at this one and this one, are they the same? They are not, right? For this first one, if you look at it, there is a thick creamy discharge, there is more swelling, there is redness. But this next one, if you look at it, there is less swelling and there is not that thick creamy discharge, even though there is redness, right? Why are they different? This first one is caused by bacteria and the second one is caused by virus. Therefore, their treatment can never be the same. So now, what is the right way to treat each one of them? Let's start with the people who have bacterial pink eye. So if yours is virus, please just wait a minute to according to you right now. In case if you have this bacterial pink eye, the treatment is that simple. Because it is caused by bacteria, the right treatment to use is to use antibiotic eye drops. But it's not every type of antibiotic that it should be used. Avoid the mistake that most people do. Because bacteria have different resistance to different antibiotics. That's why sometimes if you use other antibiotic eye drops, it will not be effective. That's why the best thing I recommend to use is to use a broad spectrum antibiotic that can fight against almost every type of bacteria. Example of such broad spectrum antibiotics is tobramycin and chloramphenicol. Now that you know the antibiotic that you can use, the next question is how often should you use it in a day? Well, it depends on your case, but moderately you should use it 30 times in a day. The second thing you need to do to get more relief is to do warm compresses. How to do warm compresses at home? Let me show you. It's that simple. Just wash your hands with soap and water and then get a clean handkerchief, soak it in a warm water and then squeeze it. After that, close your eyes and place it on your eyes. Continue like that for at least 3 to 5 minutes and do that 3 to 4 times a day. If you combine these two, use that antibiotic and you also do this warm compressive, I assure you that your pink eye will go within 2 to 5 days. Before we proceed, if this is your first time coming, I am Dr. Arun. I make videos like this to help you care for your eyes and protect your digital followers. If this is your first time coming, don't forget to subscribe to the channel. And even if you are coming back to this channel, please consider liking this video before we proceed. But wait, we are not done. We need to consider people who have this viral pink eye. What should they do? What I want you to know is this. The type of virus that is causing this viral pink eye is the same type of virus that is causing common cold. Remember, if you have common cold, it stays for about 1 to 2 weeks. And for some people, even after taking the medication, the case becomes even worse. That is because this virus, when it comes, it has to finish its cycle to go away. That means it has to stay for about 1 to 2 weeks before it finishes the cycles and go away. That's why if you have this type of viral pink eye, even if you don't take medication, it will go away on its own within 1 to 2 weeks. But does that mean if you have this viral pink eye, you should just stay like that until the virus finishes the cycle and go away? No, there are 2 things that you should also need to do in order for you to get relief from that. The first one is to do the same as what a person who has this bacterial pink eye does. That is warm compresses. The second thing to do is to use artificial tears. They are over-the-counter eye drops that you can use. They are very safe to use in the eyes So you can use any type of brand, but I personally recommend using Madzi Tears because it is more effective for most people. Here are two things I would like you to know about this viral pink eye again. Sometimes if you go to some eye clinic, you have this viral pink eye. Some eye doctors may prescribe antibiotics for you, such as ciprofloxacin. But to be honest with you, antibiotics cannot be used to treat viral case. So antibiotics are not used in treatment of viral pink eye. But I think they are giving it to you to prevent secondary infection so that bacteria shouldn't have to attack your eyes further because now your eyes is compromised. But they are not giving it to you to treat your viral case. Before you go, you have to know that both bacterial and viral pink eye can be very contagious, which means you can easily spread it to someone and he can easily spread it back to you. Therefore, it will be best to know how you can prevent it. And I simply explain how to do that in my next video here. See you there.